Ghanaian is looking for? What are the concerns and the results they're looking for?
So when you go to health placed third on the 19 items. Education was first. So let's go to the specific issues under health. They speak about expand health infrastructure, which is 47.3. So almost half of them was saying that expand health infrastructure. Then also the second one was improve NHIS to have a wider coverage. Then the third one was equip health centers with modern facilities. Then also 4, ensure quality healthcare delivery. Then 5, employ more health professionals. Employ more healthcare personnel to man the various health facilities. So these were the 5 specific.
If you don't mind, please go through them again for me, please.
Okay, 1, expand health infrastructure, 47.3%. Improve NHIS to have a wider coverage, 16.7%. Equip health centers with modern facilities, 13.3%. Ensure quality healthcare delivery, 8.7%. Employ more healthcare personnel to man the various health facilities, 6.3%.
So take the manifesto of the NDC, for example. The highlighted ones. Just read the highlighted ones.
Okay. We will uncap the National Health Insurance Levy and ensure the timely release of payment to service providers and additional funds to finance healthcare for Ghanaians. We will implement free primary healthcare from the CHIPS compound to the polyclinic level in the short to medium term. Expand health infrastructure to restore the prompt employment and timely deployment of health workers. Provide affordable accommodation within the premises of health facilities and other home ownership schemes for health and other workers. Introduce a vehicle tax waiver scheme for health professionals under a well-regulated system.
There's one behind, just a few behind. Let me just pick it up.
Okay.
And that's from the NDC. They say reward healthcare workers who accept positions to rural areas, refurbish the Confederation Teaching Hospital, and all that. And
that's a repetition of 2020. 2012, they didn't do it.
Okay, fine. So let's talk about that of the MPP, complete all agenda 111 hospitals, and of course, if we're talking about expanding of health facilities, it falls in there. So this is from the MPP manifesto on health. Complete all agenda 111 hospitals. This ensures every district gets a district hospital. Recruit more doctors and nurses and other healthcare professionals. They talked about that, in the NCC.
I think that they have employed more nurses. I think,
And then completing the digitalization of public healthcare institutions under the e-health project, scaling up health services, establish 2 additional sites in addition to the existing 6, ensuring the
additional 6.
Establish 2 additional sites in addition to the existing 6 at the Funsi and Kintampo.
So that's zipline.
Yeah. So all I'm trying to put across again is this: if you look at what the Ghanaian is looking for, the politician knows about it, because he knowing about it, he's captured it in his manifesto. So what is preventing the politician knowing the need of the Ghanaian from making it available for the Ghanaian? Because like I mentioned that of the NDC, he said in 2016 or 2020,
2012 it was in the manifesto.
2012.
Teacher actually prompted
2012.
us.
So if it's in 2012, we're in 2024, and you're still capturing it in your manifesto.
Because they couldn't do it in 2012. The MPP also said that Ghana 111 is a process, and I've told you that there are about 33 of them. What's my data? If I'm not mistaken, about over 30 of them that will be commissioned by end of November.
But when we spoke to Siansari in the same studios, Siansari told me the first quarter of 2024.
Yeah, Dave, for them, their promises is just like a man when he's at that moment and he's promising you something. So I don't give them.
So for me, I ask myself, what will it take for these people to deliver on these things they make promises to us?
So Dave, that's what I'm saying. That for me, I don't. For now, it shouldn't be an issue. There's a social contract. In December, whoever is given the mandate means that the Ghanaians has accepted that contract. It is incumbent on that person to make sure that the promises come to fruition. If it doesn't come, you explain to the Ghanaian people. If the explanation makes sense to you, they reward you. For me, what we are doing is what we have to do. Inform you what they want to do, because this is what you people said to the NCA. Almost 10,000 NCCE. This is almost 10,000 of you. We are trumpeting it. David has also gone further to tell you that even in the manifesto, some of the things you are saying specifically has been captured. Now it's for you to track it together with us. As the teacher called and we fact-checked and it was right. We are today repeating it. So tell us, so if the district hospital is in your Kokobing, it's not done. Oh, Eugene, then we can bring our vehicle, we can track it. So that's why we want to do this together.
But again, when they make such promises, and again, I'll go back to the NCC report and their findings, what they gathered. They are telling us these are the needs of Ghanaians. These are the concerns of Ghanaians. Now, if 4 years down the line, you're not able to fulfill these promises or the needs of the Ghanaians,
you should be voted out.
And then we raise concerns. Don't come and tell us that we're doing some, whatever, agenda for a particular party. It's not like an agenda.
No, but media research agenda.
What I'm saying is, an agenda means I'm sure we intentionally do something to favor somebody.
It's because those who say that don't understand.
And aside from that, you sit in your small corner. You say you belong to a certain political party. The party is not fulfilling its mandate to us. And what, you still follow the party for what purpose or for what reason?
I think that the agenda is only an agenda if it's not, going according to.
And if it's not the truth.
Yeah.
Here we haven't we spoken about Sewa? Haven't we spoken about Afari?
But Dave, on hospitals, I think that personally, I think that this government, apart from free SHS being the legacy, which will describe the Kufuor regime, when you pick Rawlings, for example, rural electrification, when you pick Kufuor, I think in the Fourth Republic, most people ignorantly think that the NDC hasn't done social intervention. But not more. I don't see a social intervention program that is bigger than Get Fund, for example. And yesterday, tomorrow, they will be here to talk about it. It is rolling. So each of the parties have done something. But I think that when you look at the Kufuor regime, education and health, they've done creditably well. Just last week, he commissioned the urology, where dialysis, for example, when you pick the health insurance now, dialysis is free for the less than 18 and above 65. So all that happenings also tells you that, David, it is possible to do some of these things if you put our mind to it. David, for example, was it yesterday or Sunday? So I was somewhere and a person identified me and called me. And Dave, the agenda 111, you remember how much they said one cost? The building was 12 million. They would do retooling of what? 4 million, 16 million. Dave, 16 million by 88 is just 1.4.
1.4 billion.
1.4 billion. Dave, how can't we do this? So it tells you that if we put our minds to it, we can do it. But it's always about what? Prioritizing it. David, again, this government has done the Vadem. Achianse Hospital, they are building one at Enyinem because of the Craig Kumasi accident. They are building another trauma. I didn't even actually know that Obuasi didn't have a district hospital. I hear is the AGA. So they are building one. So it's Obuasi and Enyinem. They done the Vadem at Achianse, Ponkatamanso, and all that. So healthcare, I think that this government has done creditably well. But the issue is that, Dave, the speed, the alacrity with which they do these things. That's why some of us were of the view that Agenda 111, hold on, completed already existing ones and let's go.
Ones,
because there's one at Tikrum, there's a cheap compound at Tikrum around where Bernard in Sheffield produced. It's not there just by the cemetery. It's not done. So I think that education they've done well, but the challenge is that they reduce every conversation to free SHS, forgetting that it is not everybody who has profited from that, or it is not everybody who...
It's not all about free SHS.
Yes.
And again, if you look at what the Guardian says to the NCC about expansion of the health insurance scheme.
Yeah.
When we're talking to the breast cancer woman, and the doctor was saying, what the doctor said? That when you have to be diagnosed, it's not covered.
Yeah.
But when you are diagnosed and then
you are treated.
But here we are, people would have to go for the diagnostics to be done.
But Dave, for that one, I won't blame government. You know who I'll blame? The MPs. Just like the LI Galamsey LI thing.
For the first
Dave, you see, sometimes too, maybe, just maybe, sometimes we are too harsh on the government.
But if you have a presidential advisor on health, can't he put some of these things across?
Dave, I'm saying that they are presidential health and whatever is one person. Akufo-Addo is one person. There are 275 MPs. Today, it's a committee which will be on kinds of idea. Say
on the health committee in Parliament.
Yes, Dave, and it's health, so it's still in the same area. Kokramna to move from all test ne de yen cover. Who koya test we will be I mean who thinks like so it tells you that sometimes maybe they don't diligently read some of these documents and check it, because when the doctor say we all shocked that how can you say that the test cannot be covered
but the treatment
will be covered? I don't get
if
it.
you don't have means to get tested, then
you should go and die. It doesn't make sense.
All right, so listeners, you can join us now with